Sophia, for that lovely, lovely introduction. It has been such a blessing to be here and be invited to be part of this community. Very enriching for me, and I hope that I can give back to you today in some way what I've reaped from your wisdom. So these are the official objectives, and I'll show you how we're going to do that. I'm going to give you a brief overview of the literature on the role of the arts and humanities in medical education. We'll have a very interactive visual thinking strategies discussion and debrief. I'll just talk more loudly. Maybe that will help. I'm a low talker, I've been told. And then we'll have, I'll share a little bit about how art can support physician flourishing and how we're doing this at Hopkins, and we'll leave some time for questions and answers. So just some background, the American Association of American Medical Colleges in 2017 launched this FRAME initiative, the fundamental role of the arts and humanities in medical education. And that initiative involved a working group. They set up a grants program, and they commissioned a scoping review. And you see what their primary goal is: to improve the practice, education, and well-being of physicians through a deeper integration of the humanities and arts in professional development. In 2018, so shortly thereafter, after the FRAME initiative was launched, the National Academies of Science, Engineering, and Medicine published this report, Branches from the Same Tree, which is a quote from Einstein about the arts and humanities and sciences. And their report concluded that the evidence is sufficient to urge the support and evaluation of courses and programs that integrate the arts and humanities with medicine in higher education. And then in 2019, the World Health Organization led this large initiative on the arts and health, concluding that future policy should include arts and humanities education within the training of healthcare professionals. So in 2020, the AAMC FRAME published their monograph, and that was in December 2020, and that was followed by the scoping review that they had commissioned about a year earlier. That was published in Academic Medicine. And the monograph made a series of recommendations focusing on the arts and humanities in medical education, including number 4, design approaches to enhancing trainee and physician well-being that integrate the arts and humanities into medicine. And I'll be talking about flourishing, which is what I prefer, the term I prefer to use rather than well-being later in the talk. So the scoping review identified 800 articles that met their inclusion criteria, and that mapped the landscape of arts and humanities in medical education across learning levels and topics. Most of the topics of arts and humanities were around literary arts, narrative medicine. A smaller percentage were visual arts, which is going to be the main focus of what I talk about today. And visual thinking strategies was a small part of that. We'll talk more about that in a moment. And you can see how it broke down with undergraduate medical education versus graduate medical education, pre-medical education, and continuing medical education. So I want to move into this interactive visual thinking strategies discussion and debrief. I know that there are people here who have heard of visual thinking strategies. How many people have actually participated in a visual thinking strategies discussion before? Okay, great. And I think there's even a facilitator of visual thinking strategies here. But for most of you, it's going to be new. So I'll give you a little background. So visual thinking strategies was developed by Philip Yenowen and Abigail Husson. And Philip was the head of museum education at the Museum of Modern Art in New York. And Abigail Husson is she's passed away. She was a cognitive psychologist who studied aesthetic development. And basically the head of the Museum of Modern Art came to Philip and said, you know, people come, they seem to enjoy the activities, the educational activities you have for them in the museum, but do they learn anything? And so they set about studying that because they didn't know the answer to that, and they found out that no, people really didn't retain much of anything that they discussed at these education sessions, and these were school children and adults. They didn't learn anything, retain any knowledge, and they didn't learn any skills that they could transfer into the rest of their lives. And so they set about studying how people look at art, especially beginner viewers, and they found that 80% of beginner viewers are really interested in the story that the art is telling. And this method, visual thinking strategies, developed out of that framework. So it's a very structured way of having open-ended discussions that are facilitated, that are prompted by a work of art. And it's been used with medical learners for over 15 years, and the evidence base for its impact on clinical skill development is growing. So we're going to be engaging in a visual thinking strategies discussion, and I just want to relieve people who might be anxious that you don't need to know anything about art or art history. We're here to learn from the art, not about the art. There's no expertise required. You just bring your own observations and perspectives. There are absolutely no right or wrong answers. There's not a closing reveal. There's not a gotcha moment. Even if the artist is present and has their own perspective, that's still just one perspective. And so when we're in the museum, I ask people not to read the plaques and to interact with the visual art. This is sometimes hard for our learners who are very verbal and are used to getting information that way, but we really want you to experience what the visual art is that you're seeing, not what's been written about it. One thing I have to say now is not to Google the image or reverse image Google search or whatever it's called. I've had that happen. Again, we're not here to get information from the web. We're here to have an experience with the art. So I often ask people not to use their phones during the discussion because if you're using your phone, you're probably not fully listening to what people are saying, and part of this experience is listening to what others are saying. Another point of relief for people is nobody's going to be called on unless you raise your hand. So everyone's going to be invited to participate, but no one is obligated to participate verbally. I also know that art can be very emotionally evocative, and it may be uncomfortable, and I just like to remind people that places of discomfort are often places of learning. Obviously, if the discomfort is overwhelming and this is no longer a valuable experience, then understandably you wouldn't want to participate anymore, but I do encourage people to stay with some discomfort because that can be a learning edge. And again, to expect and accept not enclosure. You're not going to hear me talk a lot about the art itself, and you're probably going to leave with a lot more questions than answers. And so with that, I'm going to scroll ahead because I've had several images that I was considering, but after hearing the discussions the last day or two, I've decided to pick one of those images. So I'm going to scroll past, and we'll spend about a minute just independently, silently looking at the work of art. So just take a minute to look at this. And you're welcome to come up more and closer if you want to see details. And look, if you have glare from one angle, you might want to look at it from another angle.
Okay, so we do this independently, so that we're going to be having a discussion in just a moment, and I'm going to open it up with a question. And if you want to join with a discussion, just raise your hand, Michelle, right? Michelle will bring the microphone over to you. So the question I want to open with is, what's going on in this picture? Anybody want to take a guess?
So it looks like a nurse is hunkering someone who's gotten bad news in their home.
Okay, so you're thinking about the activity that's happening, and you're thinking that you're looking at a few of the figures, and your C is set. And you're thinking that this one figure that's more in the background may be a nurse, possibly, and this person in the foreground may be in their home. Did they have just received bad news? What do you see that makes you say that they just received bad news?
He looks bad.
So there's an expression here in the maybe the face or the body posture as that suggests that they may be feeling sad. Great. What more can be signs?
We find it vicious saying that the images of alleviate take three parts. So there's one part that has a door, one part that has a patient, and one part that has what seems to be inside of a nursing home. So it feels like the patient in the middle is in a transition between these two worlds.
Okay, so you're looking at this composition as a whole and noticing that there's three parts marked by these divisions. And one has a door. One is what we've talked about earlier, the focus on the figures here. And then this has a scene that suggests for you that this might be a nursing home. What do you see that makes you say nursing home?
I believe I'd see a sort of someone sitting or a hospital bed like thing, and someone see the volume patient, but I don't see very well, so very like it.
Okay. Well, you're welcome to move up it up. From your point of view, it looks like there's a figure here, perhaps a person sitting, and there's what looks like it could be a hospital bed, maybe some assistive device in this scene that you associate with institutional settings, like perhaps a nursing home.
And the curtains on top, but you see a pretty cosy hospitals.
Yeah, and then noticing at the ceiling here this railing and into the hospital curtain that divides people from one another. Great. What more can we find?
For me, the first look like they go together, like he's just walking in. Yeah. It looks like about cut shaping in the mori. He has 3 cones in his pocket. So like that's the first thing that I saw that was. I don't know. And for the other one in the end, it looks almost like a lab simulation because that looks like a magic kit. And the ears are beds. But at first when I saw it, I was like, oh my God, he's falling and she's with him. But then looking at it more, it's immaculate. And I don't see the pictures all the same because I find the shirt is different in the first and the third. So I feel like there's 3 individual pictures. And I feel that the second picture, you just caught him because he was working or something. But, yeah.
So a couple of things. We talked about this figure before. Roy, I think, said that maybe this person was sad. You're seeing a person maybe in some other kind of state.
It is a little sad to me.
Yeah, noticing that they might be blinking, and that's why their eyes are closed, perhaps. But then you're also talking about some details with this figure. This what looks like it could be an injury from shaving here on the cheek, noticing these 3 cones and kind of puzzling over why. And then you're looking at the composition as a whole, and you're taking these 2 and kind of thinking that they're together. This is somebody who's come in and putting together a narrative that way, sequentially reading it left to right. But then this figure that I think from the back looks like it could be a person. Up closer for you, it looks more like a mannequin, for simulation, and kind of wondering where that fits in. And then noticing that these are three, for you, looking like three discrete images because the shirt pattern here looks different. And so if you may not be sort of the whole, it would be saw perhaps at first. Great. What more can be up?
I notice that on the left, there's a lot of color. The green, there's a lot of nature. Versus on the right side, you have kind of the indoors, institutionalized gray colors. And what I see, the interpretation that I'm making is that this sand is being taken care of by the person standing behind him with her hands onto his shoulders. And maybe he's falling asleep, but has in a crowd bed. And so the combs represent his pride. And in between nature where his light was, and Nak is inside this kind of home institution, the light is looking.
Okay, so kind of going back to this central figure and reading his expression, and thinking that this person might have, there might be a sense of pride that's indicated by these combs of his concern about appearance. And then you're also noticing, sort of again, putting together a narrative that this person is transitioning from being in this green, kind of outside world to this more gray institutional world. But what's really important, and what's the reason that this is central for you, is that this is there's a moment of caring here. And you're also suggesting that this person may be caring for this figure. What do you see that makes you say caring?
The hands on his shoulders, that human contact, and the fact that there's color, and I associate care with color.
Okay, so there's some brightness here, some color, kind of like you had suggested on the left side too, but you're noticing this figure's kind of hand gestures that for you, you're reading as a caring human touch. Right, what weren't you but?
Is Heather in the This picture immediately reminded me of a line from Professor Kleiman's book, where he talks about the time at which he says there are African nurses who do not have nursing licenses in America, were working for health services. The presence of these women threatened Joan's sense of self, and she went out of her way to pretend they weren't there. For some reason, that just came back to me because I thought this, like, Brenton's sense of self is kind of observable on his face, and also just a kind of chasm between, like, what is the relationship with this person. It just had reminded me of that line to where John was confused about who was caring for her.
Okay, so you're building on some of our shared experience of hearing Dr. Kleiman's talk and thinking about this figure in the back as the caregiver here, the institutional caregiver, and you're bringing to light the racial difference, and then you're also thinking that there is a chasm in some way between these two figures. And
like Asian background, just like life experiences, because a lot of times people in care settings have contacts of people with whom they maybe had contact throughout their lives in the same way. So just seems like a lot of that. Because there isn't like a warmth, a look of recognition. There's more of this like distance.
That's what I was going to ask you. What you see that makes you say that? So you're seeing a lap of warmth and the distance.
They're all looking at each other. There's also that posture of like she's over him, and he's almost like the hand gesture almost is to subdue him, and that's what can threaten a sense of self.
Okay, so kind of a slightly different reading of this hand gesture. I think earlier it was suggested it might be sharing or comforting, and you're seeing it more as kind of above and kind of restraining in some way, so controlling. And that I just harp back to this caring, controlling tension that Professor Klein talked about. Great. What more can we find?
Info in the far right of the mantelpiece. It seems like it's a storage closet. It's disorganized and it's like in the corner of the nursing home. And so to build out the concept earlier about the journey, it reminiscent of me of like how this American society essentially processes and deals with older adults, which is they're entering to the door, they're cared for in some ways, and can be great, can be strained institutionally, and then they're kind of often like shoving to a corner. It's disorganized, it's not support. The mannequin looks isolated, looks like it's not supported at all. And so it reminds me of like a what person journey through the institution of caretaking.
Okay, so kind of thinking about this metaphorically, as some people have been doing, and thinking about this as a narrative from, independence in a way, through aging, through dependence on another person, to sort of kind of warehousing, for lack of a better word, thinking of this as like a storage closet, that there's some suggestion of that this is a corner, kind of a neglected space, and that this figure, in fact, is kind of more than abandoned, is sort of abandoned in a state of debilitation. What do you see that makes you say kind of abandoned in that way? I'm putting words in here, not by that abandoned.
Yeah, I think it's fine. It looks messy, first of all. There's a chair, there's a bed, there's a cardboard box, there's a whiteboard opus in the background, there's some cloths sitting on the bed. And the mannequin itself is like drooped over, it's falling over, it's like half clothed. It doesn't, you can't really see its space, so it's hard to grasp. Though it is a mannequin, hard to grasp its identity. What especially had is.
Yeah, so I was looking at some of the more of the details, not only the disarray in this area, but also the positioning here of this figure, about what they are. For the part unclothed, there might be some drapery here and there, but they're slumped over. We can't see their face, so there's a sort of dehumanization that's going on that section. Great. What's working up that?
My eyes are drawn to the simple figure again, and I think this is a memory creating that based upon that he has 3 different combs in his pocket, so I think it explicits habits of the comb there, and I think somebody objected them based on the book of doing this, and that people believe.
Okay, so thinking about the setting more, it suggested this could be a home, this could be an institution. You're thinking it's a specific kind of institution, a memory care unit, and some of the evidence for that is 3 combs, because that was something is being puzzled over, and you're thinking, well, maybe it's because they have this habit of putting a comb in their pocket and have sort of forgotten how many combs they had in their pocket. And then it was brought up that this could be a shaving accident, but you're thinking, well, it's probably more likely to have that this person has been shaved by somebody else and cut, because it's very difficult to kind of judge that you meet the pressure, things like that. And so more accidents may be more likely to occur.
And my views depend by sign and the experiences taking care of it already. Yeah.
Okay.
This
So drawing on your own personal experience for that and how difficult that is and challenging. Right. What more can we borrow? Oh, you have somebody up here who hasn't spoken.
And I share with you because I see the little picture I took about my father Alzheimer, and that is something that is, when I was going and visit him, I saw that kind of image directly in many other patients that were in the facility. But what I want to make a comment, I count myself really challenged by art that is made by picture plates. Because for me, if I can see, the entirety of the feature, It's challenging always because you want always to understand what that means for you, right? But to see a fate and see the view behind or on the side there is another person. And what's going to be the next fate? This is what challenges me the most. And in a sense, I relate to the fact that when I start something, I want to see that into it. But then this is what goes.
Okay, so a couple things. So kind of drawing on your own personal experience and thinking, well, that's for you also reminds you as somebody who has dementia, and it's a recognizable kind of maybe expression or pattern. But then you're also thinking about this idea of what's outside the frame and thinking that there is, a deliberate fray to the composition. And it's a little unsettling. So you're having this emotional response to wondering what you can't see and what's beyond. And just thinking about that. Great. What more can we find? We have time for a couple more.
So I'm looking at planes of focus that is different for each of the few segments. So in the one almost left, we're focused on the snow trespassing. Where is it only towards that side? This we're going to see that this is not laying that best long-term care facility because these would be hidden in my imaginary bookcase crates or something like that. And so, yes, the focus would be we draw it to the center because he's in bookcase. And then on both sides is flanked by the focus that's in the background, right? So I couldn't really see what was happening on the right beside, so there you go, that's that. I thought it was actually a person who had passed. Someone else said that's an addict, and I'm a little bit less taken back by the image. But for me, the thing of focus, I so to focus your camera on emergency exit, to have that print, it also shows like this imaginary exit. You can't use the exit. It looks like an exit, but you can't use it. You learn it to sound. And then it's almost like this, and he's being transitioned into this from an early idea, but the closet, the left behind, the storage. So he's being either comforted or coerced into bless him along the right.
So kind of a mixture of whether this is comfort or coercion, but there is something to suggest, looking at the kind of what's most in focus here, this emergency exit, which really isn't an exit, and it doesn't have a possibility of leaving. And so there's this kind of trap. This person may be sort of trapped in this kind of center, and thinking about how that doesn't seem realistic for a memory here. So where the door would be visible, but kind of looking at those planes of focus and looking at what the artist may be intending us to learn from this and also see most clearly. And you're right, from far away, that as you get closer, many people might still read this as a person. There's some ambiguity there of whether that's a mannequin or a person. Right. What more can we find? I have time for one more.
I can see two people there. The first, the left, the back of a man, the reflection in our chair. That is the same of a piece of the arm. And another man that is in front of him. You see?
No?
This is a man with a wheelchair with the same skirt. And this is another man that is patched there. So,
Yeah, so thank you for drawing our attention to this. So we were talking about that plane of focus on that writing, emergency exit only. But if you look beyond that, it looks like there could be a reflection of this same person in the wheelchair. Oh, another person, not this person. And what do you see that makes you say not this person? person, not a... Because there's only one figure here. Okay, so another person here in the reflection, and kind of thinking about who that could be and where they might be in this space too. Okay, great. Thank you for clarifying that. I might, for the sake of time, I know there's so many more observations and we're just kind of getting started, but hopefully you got a taste of the visual behavior strategies discussion. And I really thank you for looking so closely after so long. Thank you.
So most people only look at art for about 11 seconds. So this piece, by the way, eventually look it up. It's by David Hilliard, and it's called The Inconvenience of Visitation. Oops, here we go. Okay, so I like to have a little debrief, thinking about the process. What did this process ask of you? What did the facilitator do to support the discussion? And then a few thoughts, because we'll go into it more, I think, later in the Q&A. How is this relevant to medical education and practice, to the theme of caring, and to physician flourishing? And so anybody, just raise your hand and Michelle will bring the microphone around because she's great. Thank you.
I think that the most striking thing is how we all see different things, and as someone else points something out, you say, "Oh, that's true. Oh, that's true." So it is a shared, path of deepening our understanding of our hypothesis of what's happening.
Yeah, we're all observing the same thing, but we're making meaning and seeing different things together, and maybe your attention is being drawn to something you didn't see before, or another idea about what you've seen, another interpretation of what you've seen by hearing the perspectives of other people. So really appreciating those multiple perspectives. Great.
I'm biased, so for me this means asking to ask more questions, going deeper, asking for reasons, asking for a more than a superficial reaction.
Yeah, so there is this interpretation of the observation, but if somebody didn't supply evidence, or if they supplied a little and I wanted to hear more evidence, I would ask, what do you see that makes you say that? So that's an exercise in critical thinking, grounding the interpretation in a visual observation. Sometimes you don't have a visual observation, and then you realize it's from your own background and experience, and that there might not be a lot of evidence for what you're seeing, but or it might be difficult to articulate, but bringing that metacognitive process to light. Great.
To try to answer your question, I think it's relevant because it, in a sense, is a moment of pause and observation. When we first, I think it's very relevant, when we first go and meet for the first time our patient, then we take a moment to pause and observe before rushing into it, overwhelm our patient with questions, and just learn how to observe what they can give us first.
Right. Spending some time closely observing and looking at, maybe more than just kind of the main central part of what we're looking at. If we are thinking of this as a sort of a proxy for a shared observation of a patient, maybe looking at their home setting, if we're seeing them in the home, looking at their room, looking at things that are there or other people that are there. So kind of spending more time just looking before diving in with our questions.
I was kind of shocked because I see these patients all the time in my work, and I didn't get half of what everybody was saying, and I think because I didn't want to go there.
Mm-hmm.
I'm just tired, and I didn't want to, I just blocked it out.
Yeah, so raising a really important point about our own sort of kind of, I wouldn't say willingness, but almost ability to engage in certain observations if it's too close, if it's, brings up other kind of associations, and it may be something we don't really want to look at, and acknowledging that and learning, getting some personal insight from that.
I was thinking that maybe we shouldn't get tunnel vision so that we see the, like Dr. House. But there are many different ways of seeing this, and so maybe the way you're seeing it isn't necessarily the right way. It's just one way.
Yeah, so there is this ambiguity, and the idea that there could be multiple possibilities and no closure, and certainly not premature closure about what is kind of the right answer and there may not be a right answer, and being able to sit with that uncertainty. Two more, and then we'll go on to the next section.
It's very interesting because you reminded me of what therapists we do is kind of like reflecting a lot and not trying to give answers. And I think this active listening is really what is key for healthcare practitioners, because we have this tendency to jump to the solution right away because we see the problem. So instead of just listening first, what is going on.
Yeah, so kind of pointing out the role of the facilitator and how that is relevant to being a caregiver and a teacher, and not coming in with an agenda of something I want to impart, but having the group kind of make meaning that's relevant to them. And that active listening and paraphrasing, hopefully didn't overstep the paraphrase. Maybe I did it a couple times, but also kind of creating the psychological safety for somebody if I didn't get it right or I missed something, to be able to speak up and clarify, as you did. Thank you. Coming up to say, no, this is what I meant. And that really helps. And that's one of the purpose of the paraphrase, to make sure we're kind of, I'm understanding what you're saying, and that we're all kind of on the same page. It was hard to point because I'm not tall enough for the screen, but that's also part of the pointing too, is kind of visually paraphrasing, make sure that we're looking at the same part that we're talking about and we're aligned that way. So I'm going to move us on just to say that there's a lot of evidence for visual thinking strategies' impact on skills that are relevant to medicine. Some of these have been studies have been done in medical learners. That's a link to a systematic review that came out a couple of years ago. But these are things, I think we've touched on most of these: close observation, reasoning with evidence, revision of ideas, communication, the listening, empathy. We didn't talk about that specifically, but this was, people did bring it, their emotional responses, appreciation of multiple perspectives, openness to the unfamiliar, tolerance of ambiguity, and self-efficacy and perseverance, kind of that endurance. So the question is, how can art support physician flourishing, and how we're doing this at Hopkins? So as was mentioned by Sophia, I direct this program for human flourishing at Hopkins. Our mission is primarily an educational one, and we use this flourishing model developed at Harvard by Tyler Vanderweel. So Tyler Vanderweel is a statistician who's at the School of Public Health. He directs their human flourishing program there, and he developed a measure of human flourishing based on his study of large epidemiologic data sets. His area of expertise in statistics is drawing causal links from these large data sets. So these are data sets that followed people for 30, 40 years. And he looked at what most people in the literature suggests are things that we want out of life: a good life, happiness and life satisfaction, physical and mental health, meaning and purpose, character and virtue. We want to be good people, and close social relationships. And he then worked backwards to see what factors predicted people or led people to have these outcomes from these data sets. And he found that there were 4 factors: family, work, education, and religious community. And so his work has he developed this flourishing measure. It's now in partnership with Baylor, Gallup, and the Open Science Institute. His flourishing measure is being given to a representative sample of half the world's population. And the first wave of data came out about a year ago through the Global Flourishing Study, and that papers, I think 26 simultaneous papers were published, simultaneously in around April of this year from that first wave of data. And I just will make the point that came out of that first wave of data because it underscores what was said about immaterial poverty. So if you think of the opposite of flourishing, you might think of immaterial poverty or languishing. And it was found that the countries that were highest in GDP had the lowest flourishing for the most part. And that low flourishing was based on lack of pro-social behaviors, fewer close social relationships, and lack of purpose. And the countries that had the highest religious service attendance actually were 20 out of 22 of them had higher flourishing. And then the other big finding from that first wave of data was that the older you get, the more you flourish, and the people who were flourishing least were young adults. So we've written an entire article on how art can support physician flourishing across all 5 domains, but I'm going to focus on a different article that we wrote about how art can support the domain of character and virtue. And we use the Jubilee Center for Character and Virtues, University of Birmingham framework to review, in that paper, to review the empirical studies of our programs, or programs that featured visual thinking strategies as a pedagogical method. They also use the flourishing model from Vanderweel. They define character as that set of personal traits or dispositions that produce specific moral emotions, inform motivation, and guide conduct. And that includes virtues, defined as specific character traits that promote positive and morally good interactions in life. So they categorize the virtues into 4 types: intellectual, moral, civic, and performance virtues, and then highlight the discernment of right action that requires not only development of those virtues, but also the virtue of practical wisdom. And some examples of intellectual virtues for which we have evidence on arts-based teachings impact are curiosity, close observation, critical thinking. For the moral virtues, empathy, open-mindedness, and humility. For the civic virtues, perspective taking and civility. And then for the performance virtues, perseverance, teamwork, motivation, and resilience. So I list 2 articles here just because they outline the evidence suggesting that arts engagement can enhance well-being among physicians and medical learners. But I also want to really draw your attention to the second paper by Frush et al., that talks about the differences between wellness and flourishing, because wellness often sets up an opposition between wellness and work, and their recommendation is to integrate the wellness and flourishing constructs to avoid that tension and conflict. So I'm going to shift gears just to tell you how we've applied all of this to the design of our 4-week course for medical students. So we began piloting sessions at the Baltimore Museum of Art in September 2019. Out of necessity during the pandemic, we adapted these piloted sessions to be part of a 1-week online course, and we have published on that. We ran that course 6 times. And then when the museum started to reopen in 2022, we were able to return to the museum to offer our intended 4-week course. These are the course objectives. I won't go into that for the sake of time. The course takes place over 4 weeks. It's for 4th-year medical students. Each week is guided by a theme related to flourishing. It's 17 3-hour sessions. Initially, we offered 5 of these online and the rest in the museum, and that was because after our online course, we would survey the students and say, if we ever offered this in person, would you want it all in person or some online? And they said some online. And then after we offered this course in January 2022, the feedback we got was no more online, we want all in person. So since then, our course has been all in person. And Then we also renamed that self-care week to Flourishing because there was a lot of dissatisfaction from the students about this label of self-care because it really puts that burden on the students rather than the kind of systems and institution. And you can see how we kind of set up these weeks: family, community, education, work, self-care. We begin each session, each of the 17 sessions, with a check-in. We just briefly ask people how they're doing, how they're feeling that day. And then most sessions include a visual thinking strategies discussion. Some of those are led by me, some by Philip Yenowin, who also lives in Baltimore now and is part of our course. And we select artworks for visual thinking strategies in a variety of settings, including at the Baltimore Museum of Art, which is shown here, as well as other Baltimore and DC museums. We also lead discussions of projected images. For instance, we visit the Homewood Museum, which is a historic house on the Hopkins campus in which enslaved people lived, and we lead a discussion of this painting in the basement where this quote-unquote slave quarters were of the home. We also lead visual thinking strategies discussions of art in the hospital, pieces that our students have walked by for 4 years and never given a moment's attention to. We also go to the Hopkins Medical Archives and have discussions of some of the portraits there. This is of Helen Taussig, two very interesting and different portraits. And we follow that up with a mask making session, which you'll see in a moment. We also go to the community and have mural or street art discussions. And then we also lead non-visual thinking strategies activities in the course, like a personal responses tour, which I won't go into, but there's several papers about it. We do back-to-back sketching. We have forest bathing, in which students slowly move through a natural landscape, cultivating a sense of presence by noticing what they see and hear. And we do the mask making, which is led by a guest facilitator, Mark Stevens, who I think is probably the world's expert in professional identity formation and using masks to provoke discussions of this. And then after visual thinking strategies and whatever other unique activity we offer at that session, we always have a guided written reflection to an ambiguous prompt. For instance, we might ask them to write about a family member that they've never met. They spend 10 minutes writing, and then if they want, they can share what they've written or they can share what the process was like. And then we conclude each session with a live reading of a poem or the playing of a recorded song. We've evaluated the course both quantitatively and qualitatively. I just want to highlight a few of the key outcomes. We evaluated our course quantitatively through surveys that are administered before the course and after its conclusion. The surveys include scales for capacity for wonder, tolerance for ambiguity, and interpersonal reactivity index, which is a measure of empathy, and openness to diversity. Those last three measures were chosen because they're all part of the matriculating and graduating student questionnaires. So we have means for about that have been reported for about 10,000 students in the literature. And then the capacity for wonder scale was developed at Hopkins, as was the tolerance for ambiguity scale, actually. And so we have means for the Hopkins students as well. So we were able to know what the means were for these scales. And we, because the question comes up, our course is an elective course. Are the students kind of, predisposed, very empathic people? Well, they came in actually below the mean on all these scales. And I don't know why they took the course, if that's how they felt. But anyway, the good news is that after the course, we observed an increase in the scores across all the domains, with the scores in the first domains going from below the reported means to above the means, and those in the latter two going from below the means to the means for the of those scales. And then these two were statistically significant increases. And then we also evaluated the course qualitatively. We've done this many times with different sets of data from different cohorts. We have reflective writing we have a formative reflective writing after every week of the course, and then we have a summative reflection. And then we had semi-structured interviews that were conducted by somebody not associated with the course after the grades went in. And there were 4 particular themes that emerged from that first cohort. They found that the impact for them was the ability of art to connect with themselves, with their own personal values, time to be free from distractions and just kind of be centered on an activity. They did feel like it fostered their professional identity formation and helped them connect with others and other perspectives. And with that, I'm just going to open it up for questions, and here's information if you want more. Thank you.